To see if you have flat feet or how you can fix them, check out this video on parshealthhtv. Number 7. Know the types of flat feet. Flat feet are normal for children until at least age 5, and sometimes as late as age 10, because the bones, ligaments, and tendons in the bottom of the foot need time to form to support the arch. So, if your child has flat feet, don't panic, especially if it doesn't seem to cause pain or problems when walking or running. It's likely that your kid will grow out of it, so there's no need to seek treatment and try to do so. A flat feet test is performed to detect flat feet. Wet your feet, then step on a dry surface that shows your feet. If you can see the entire surface of your foot in the footprint, you have flat feet. People with normal arches have a crescent-shaped negative space on the medial, inner, part of the footprint due to lack of contact with the surface. Flat feet rarely cause pain in children. Number 6. Lose weight if you are overweight. If you are overweight, especially obese, losing weight has many health benefits, including less stress on the ligaments, bones, and tendons of your feet and better blood flow to the area. Weight loss will not reverse stiff, flat feet but will have some positive effect on other types of flat feet. For most women, consuming less than 1800 calories per day will result in weekly weight loss, even if you are only a light exerciser. Most men will lose weight every week if they eat less than 2200 calories a day. Many obese people have flat feet and are prone to excessive ankle pronation, collapse and inversion of the joint, which can lead to a knock knee position. Sometimes women develop fallen arches later in pregnancy that disappear after the baby is born. To help with weight loss, eat lean meats, poultry and fish, whole grains, fresh vegetables, and fruits, and drink plenty of water. Avoid sugary drinks like soda. Number 5. Get custom orthotics. If you have flexible flat feet, not completely rigid, and spend a lot of time standing or walking, consider custom orthotics. Orthotics are semi-rigid insoles that support the arch and promote better biomechanics when you stand, walk, and run. By providing cushioning and shock absorption, orthotics also help reduce the likelihood of problems with other joints, including the ankles, knees, hips, and lumbar spine. Orthotics and similar braces will not reverse the structural deformities of the foot, nor will they restore the arch with prolonged wear. When using orthotics, it is usually necessary to remove the factory insoles. Some health insurance plans cover custom orthotics, but if you don't, consider orthotic insoles. They're less expensive and can provide adequate arch support. In fact, in some cases, they have been shown to be as effective as custom orthotics. Number 4. Tight tendons can cause flat feet. A tight Achilles tendon at birth, congenital, puts too much pressure on the front 3/4 of the foot, preventing the formation of a normal springy arch. The Achilles tendon links the calf muscles to the heel. If it's too tight, the heel can lift off the ground prematurely with each step, causing stiffness and pain in the sole of the foot. In this condition, the foot becomes flat when standing but remains flexible when weight-bearing. The main treatment choices for flexible flat feet with congenitally short Achilles tendons are aggressive stretching programs or surgery, which are explained in more detail in another video on our channel. To stay up to date with our latest videos, make sure to subscribe and press the notification bell button to get some interesting stuff and upcoming videos. Number 3. Try some intensive physical therapy. If your flat feet have some flexibility, rather than stiffness, and are primarily caused by weak or tight tendons or ligaments, you should consider some form of rehabilitation. A physical therapist can demonstrate specific and tailored stretching and strengthening exercises for the foot, Achilles tendon, and calf muscles to help restore the arch and make it more functional. Physiotherapy is usually required 2 to 3 times a week for 4 to 8 weeks to have a positive effect on chronic foot problems. A common stretch for a tight Achilles tendon involves bringing your arms back against a wall while extending one leg behind you. Be sure to place the extended foot on the floor to feel the stretch across the heel. Hold for about 30 seconds and repeat 5 to 10 times a day. A physical therapist can wrap a strong tape around your foot to help relieve symptoms by providing a temporary artificial arch. A physical therapist may also use therapeutic ultrasound to treat an inflamed and tender arch, a common complication known as plantar fasciitis in flat feet. Number 2. Wear more supportive shoes. No matter what type of flat feet you have, a shoe with good arch support will provide at least some benefit and possibly complete relief from foot, leg, or back symptoms. Try to find a comfortable pair of walking shoes or sneakers with solid arch support, a roomy toe box, a sturdy heel counter, and a flexible sole. Supporting the arch of the foot helps reduce stress on the back of the tibial and the Achilles tendon. Avoid shoes with a heel higher than 2 inches, as this can lead to a short or tight Achilles tendon. However, wearing perfectly straight shoes is also not an option because the pressure on the heel is too much, so use shoes with a heel about 1.4 or 1.2 inches higher. Get fitted for shoes by a qualified salesperson later in the day because that's the time your feet are at their largest, usually due to swelling and slight compression of your arches. Number 1. Discuss surgical options with your doctor. If flat feet are causing you a lot of problems and supportive shoes, orthotics, weight loss, or intensive physical therapy have not helped significantly, talk to your doctor about possible surgical options. Your doctor may use a CT scan, MRI, or diagnostic ultrasound to better understand the soft tissues of your foot. In severe cases of very stiff flat foot, especially if it is caused by tarsal syndesmosis, an abnormal fusion of 2 or more bones in the foot, surgical recommendations are possible. Surgical treatment is also recommended for chronically tight Achilles tendons, usually a simple operation to lengthen the tendon, or excessively lax posterior tibial bones, by shortening the tendon. Your GP is not a foot, bone, or joint specialist, so if you need surgery, you may be referred to an orthopedic surgeon. If you found this video helpful, be sure to like it and subscribe to get more informative and helpful videos. And please share our videos with your friends to support our team. Thank you, guys, for tuning in. Hope you have a wonderful day.